Never take clove. With these foods, it secretly puts your heart at risk. You reach into your spice cabinet and pull out that familiar, fragrant jar of cloves. Maybe you sprinkle a little into your oatmeal, stir some into your tea, or add a pinch to a dinner marinade. You probably do it thinking you're adding a little boost of flavor and health to your day. And you're not wrong. Cloves, the dried flower buds of the Syzygium aromaticum tree, are a nutritional powerhouse. They're packed with fiber, vitamins, and minerals, especially manganese, which is crucial for brain function and strong bones. They are also incredibly rich in antioxidants that protect your cells from damage. The star of the show in cloves is a compound called eugenol. It's a natural antioxidant and the source of many of cloves' benefits, from fighting infections to potentially reducing pain. But here's the critical truth that often gets lost. Eugenol is powerful. So powerful, in fact, that when it mixes with certain common foods and medications, it can disrupt your body's most critical systems. We're not talking about a minor side effect. We're talking about interactions that can lead to emergencies. In this video, we're going to look at the other side of this beloved spice. We're not here to tell you to throw out your jar of cloves. A small amount used in cooking is generally safe for most people. But we are going to reveal the 3 specific things that should never be combined with medicinal amounts of clove, like those found in clove tea, clove oil, or concentrated supplements. Understanding these interactions isn't just important, it could be a matter of life and death. Before we reveal the first combination, we want to hear from you. Have you ever been surprised by the side effects of a natural remedy? Let us know your experience in the comments. Your story could be the wake-up call that helps someone else in our community stay safe and informed. Number 1. The blood-thinning blend, clove and anticoagulants. The first, and arguably most dangerous interaction involves blood clotting. Picture this. You take a daily low-dose aspirin for your heart, or maybe your doctor prescribed a stronger blood thinner like warfarin or clopidogrel to prevent blood clots. You're doing everything right. Then, in the evening, you brew a comforting cup of clove tea to unwind, thinking it's a great, natural way to get more antioxidants. You have just, completely innocently, created a high-risk situation inside your own body. Here's why. The main active compound in cloves, eugenol, has a well-documented effect. It slows down blood clotting. It acts as a natural antiplatelet agent, meaning it stops blood platelets from clumping together to form a clot. On its own, that might sound useful, but when you combine it with medications designed to do the exact same thing, you create a compounding effect that can be incredibly dangerous. Millions of people take medications that slow blood clotting, known as anticoagulants or antiplatelet drugs. This includes prescription drugs like warfarin, Coumadin, clopidogrel, Plavix, and apixaban, Eliquis, but also common over-the-counter pain relievers like aspirin, ibuprofen, Advil, and naproxen. Each one intentionally reduces your body's ability to form clots to prevent heart attacks and strokes. When you introduce medicinal doses of clove, like clove oil or strong clove teas, into a system already using these drugs, you're essentially pouring gasoline on a fire. The anti-clotting action is no longer controlled. It's amplified. This dramatically increases your risk of severe bleeding and bruising. A small cut might bleed for far too long. You could find bruises on your body with no idea how they got there. In the worst cases, this combination can lead to dangerous internal bleeding or a hemorrhage, which is a life-threatening medical emergency. And this isn't just a theory. Medical professionals consistently advise anyone with a bleeding disorder to be extremely careful with clove for this reason. The advice is even stronger for those facing surgery. It's recommended to stop using clove in any medicinal quantity at least 2 weeks before a scheduled procedure. Why? To prevent the risk of uncontrolled bleeding when your body's clotting ability is most critical. The danger also extends to other healthy foods and supplements with natural blood-thinning properties. Think about garlic, ginger, and turmeric. Garlic's compound, allicin, is a natural anticoagulant. Ginger has been compared to aspirin in its ability to prevent clots. Turmeric's active ingredient, curcumin, has similar effects. Imagine taking a garlic supplement for cholesterol, drinking ginger tea for digestion, and using clove oil for a toothache. You've just mixed your own potent, unregulated blood-thinning cocktail without a single prescription. While a sprinkle of turmeric in curry or garlic in pasta sauce is unlikely to be an issue, the risk shoots up when you use concentrated forms like supplements or oils, especially if you're already on a prescribed blood thinner. So the bottom line for this first category is clear. If you take any medication that slows blood clotting, from daily aspirin to prescription warfarin, you must avoid concentrated forms of clove like clove oil and strong clove tea. The same goes if you regularly take other potent natural blood thinners. The risk of severe bleeding is just too high. This is a conversation you absolutely must have with your doctor. Don't assume that because it's natural, it's harmless. In this case, natural can be dangerous. Number 2. The blood sugar crash. Clove and diabetes medications. Now for the second critical interaction, one that affects the millions of people managing diabetes or pre-diabetes. They live a life of careful balance, monitoring blood sugar, and often relying on medication to keep their glucose in a safe range. The goal is to avoid both dangerous highs and the immediate danger of hypoglycemia, where blood sugar drops perilously low. Clove is often promoted for its potential to help regulate blood sugar. Studies have shown that compounds in cloves can help lower blood glucose levels. One study found that a clove extract helped cells take up more sugar from the blood and improved the function of insulin-producing cells. On the surface, this sounds like a fantastic, natural partner to prescribed treatment. But this is a classic case of too much of a good thing. The problem happens when clove's natural blood sugar lowering effect is combined with medications that are also designed to lower blood sugar. This includes all forms of insulin and oral diabetes drugs like metformin, glipizide, or glyburide. These medications are carefully dosed by a doctor to hit a specific target. When you add medicinal doses of clove to this equation, you're introducing a powerful, unmeasured variable. The eugenol in cloves can work with your medication to cause your blood sugar to plummet far too low. This condition, hypoglycemia, is a serious and potentially fatal medical event. Hypoglycemia often starts subtly. You might feel shaky or jittery. A sudden wave of anxiety might wash over you. You could break out in a cold sweat. As your brain is starved of glucose, you might get confused, have trouble speaking, or experience blurry vision. You might feel dizzy, weak, and intensely hungry. If your blood sugar keeps dropping, the symptoms get much more severe, leading to seizures or even a coma. Even moderate episodes are dangerous, causing falls and accidents. For someone with diabetes, avoiding low blood sugar is just as important as avoiding high blood sugar. This is why it's so important to be careful. Combining clove supplements or strong clove tea with your diabetes medication could push you into the danger zone. Anyone with diabetes who chooses to use clove regularly must monitor their blood sugar very closely and, most importantly, talk to their healthcare provider first. Your doctor needs to know everything you're taking, including natural supplements, to manage your health safely. The promise of a natural remedy is tempting, but the risk of a hypoglycemic event is severe. Do not self-prescribe clove as a treatment for diabetes. The interaction with your medication requires professional medical guidance. If you're finding this information valuable and think it could help someone you know, please take a moment to press the like button. And if you want more health insights that can help protect you and your family, make sure you subscribe and hit the notification bell. Your support helps us create content that can make a real difference. Number 3. The liver logjam and doubling down on danger. Our third and final category involves a more complex, behind-the-scenes interaction in your liver. We'll also revisit the blood-thinning risk to show how combining clove with other common foods can be dangerous even without prescription drugs. First, your liver. It's your body's master detoxification plant. It uses a family of enzymes known as the cytochrome P450 system to break down a huge number of prescription drugs and other compounds. Think of these enzymes as workers on an assembly line, taking apart chemicals so they can be used or safely removed. Research shows that eugenol, the active compound in clove, can interfere with this system. It can slow down several key enzymes that metabolize countless medications. When these enzymes slow down, the assembly line in your liver gets backed up. What does this mean for you? If you're taking a medication that's broken down by these enzymes, concentrated clove can cause that drug to build up in your bloodstream to higher than intended levels. This can dramatically increase the risk of side effects or even lead to toxicity. The list of drugs affected is massive, covering everything from antidepressants to blood pressure and cholesterol medications. This creates a general rule of caution. If you are on any long-term prescription medication, adding a potent supplement like clove oil without talking to your doctor is a gamble. You're altering the very system your body uses to process your medication safely, creating a potential logjam in your liver. Now let's connect this back to our first point on blood thinning. This third category is about doubling down on danger by combining clove with other common foods that have similar effects. As we discussed, clove thins the blood, but so do many other everyday foods. We already mentioned garlic and ginger. Let's add cinnamon, which contains coumarin, a compound from which the drug warfarin was originally derived. Turmeric's curcumin is a known antiplatelet agent. Fish oil, famous for its omega-3s, also reduces platelet clumping and can increase bleeding risk at high doses. Someone might not be on prescription blood thinners and think they're in the clear. But consider this routine. They take a fish oil supplement for heart health, a turmeric capsule for inflammation, drink ginger tea for digestion, and add a few drops of clove oil to their water. Without realizing it, they've stacked multiple substances that all push the body's clotting system in the same direction. For this person, a minor injury could lead to major bleeding. If they needed emergency surgery, their risk of complications would be much higher. This synergistic effect is a hidden danger because each item is considered healthy. It's the combination, the cocktail, that creates the risk. So, the third thing to never take with clove is a combination of other potent, bioactive foods and supplements that amplify its effects, particularly its blood-thinning properties. This includes high-dose supplements of garlic, ginger, turmeric, cinnamon, and fish oil. It's about recognizing that these natural compounds are powerful chemicals. When you mix them in concentrated forms, you become your own unregulated pharmacist, and the results can be serious. So, what's the bottom line? Cloves are a remarkable spice. In the small amounts you use to flavor a pie or season a roast, they are generally safe and a wonderful part of a healthy diet for most people. However, the story changes completely when we talk about concentrated medicinal amounts in supplements, essential oils, and potent teas. The power of eugenol must be respected. We've covered 3 critical combinations to avoid. First, never combine medicinal clove with anything that slows blood clotting. This includes prescription anticoagulants, over-the-counter NSAIDs like ibuprofen, and potent supplements like high-dose garlic and ginger. The risk of severe bleeding is real. Second, if you take medication for diabetes, don't mix it with clove supplements without talking to your doctor. The combined effect can cause a dangerous drop in blood sugar. And third, be mindful of the stacking effect. Avoid combining concentrated clove with a cocktail of other bioactive supplements like fish oil, turmeric, and cinnamon. And remember, clove can interfere with how your liver processes a wide range of medications. The message here is not to fear the spice aisle. It's a call for informed respect. Natural doesn't automatically mean safe for everyone in any amount. The most important step you can take is to have an open, honest conversation with your healthcare provider. Tell them about every medication, herb, and supplement you are taking. Which of these 5 combinations surprised you the most? Was there one you were doing without even thinking about it? Share your thoughts in the comments below. Your story might just help someone else. That is the only way to ensure you are building health, not secretly mixing a dangerous cocktail in your body.
And with that, we wrap up today's video. Let us know your thoughts in the comment section below. For more queries, I have also added some studies at the end of this video description. Please subscribe to my channel and hit the bell icon for the next video. Don't forget to like, comment, and share. Stay healthy, stay fine.